Isn't it frustrating sometimes you've done everything right? You're trying to enjoy your retirement, maybe tending the garden or playing with the grandkids, and then suddenly that familiar ache starts, or your stomach feels upset, or you just don't feel quite right. It feels like there's always something holding you back, doesn't it? Little health niggles that pop up unexpectedly, making you feel older than you are, slowing you down, and sometimes even making you worry. We all want to feel our best as we age, to have that energy and comfort to truly enjoy these precious years. But those aches, the digestive woes, the skin irritations, they can really steal your joy and independence. You might think you need expensive remedies or complicated treatments, but sometimes the most surprising solutions are right there in your kitchen cupboard. What if I told you there's a simple, inexpensive item you probably already own that could help tackle not just one, but maybe even 13 common health issues that often bother people over 60? It sounds too good to be true. I know. But there's a quiet power in this everyday ingredient that our grandparents and great-grandparents knew all about. In this video, we're going to uncover the surprising ways you can use this humble household item to find relief from indigestion, soothe joint discomfort, improve your oral health, and so much more. We'll explore 13 specific problems it might help with and show you exactly how to use it safely and effectively. It's about taking control, finding simple, natural ways to support your body, and feeling more comfortable and energetic every day. Stick with me until the very end, because there's something we'll reveal that might truly surprise you about this simple solution. Let's start with one of the most common complaints I hear, especially after a meal: that burning feeling in your chest, or that uncomfortable fullness in your stomach. Yes, I'm talking about indigestion and heartburn. It can strike after eating something a little too rich, or maybe just out of the blue. That gnawing ache, that sour taste that creeps up. It really puts a damper on enjoying your food and the time spent sharing meals with loved ones, doesn't it? You just want it to go away. And fast. Well, here's where our simple kitchen hero, ordinary baking soda, steps onto the scene. Baking soda, scientifically known as sodium bicarbonate, is a natural antacid. What does that mean in plain English? It means it can help neutralize stomach acid. When you have heartburn or indigestion, it's often because stomach acid is acting up, either too much of it or it's splashing where it shouldn't be. Think of it like a tiny fire in your chest. Baking soda comes along like a gentle firefighter, helping to put out that fire by balancing the pH. Now, how exactly do you use it for this? It's incredibly simple, but there's a right way and a few important things to remember. The most common way is to mix a small amount of baking soda with water. Take about half a teaspoon of plain baking soda. Make sure it's fresh, not something that's been sitting in the back of the cupboard for years absorbing odors, and dissolve it completely in a glass of water. Say about 4 to 8 ounces. Stir it well until you don't see any grainy bits at the bottom. Then, slowly sip this mixture. Don't gulp it down quickly. Take your time. You might feel a little bit of burping afterwards, and that's actually a good sign. That's often the baking soda reacting with the stomach acid and releasing gas, which can help relieve the pressure and discomfort. For many people, relief comes surprisingly quickly. It's a go-to remedy for many folks who prefer a natural approach before reaching for over-the-counter options. Now, while it's simple and often effective, it's important not to overdo it or use it too frequently. This is meant for occasional relief, not a daily habit. Using too much or too often can actually cause other issues because of the sodium content. And if you have high blood pressure, it's definitely something you should talk to your doctor about before trying regularly. Also, if your indigestion or heartburn is severe, happens very often, or comes with other worrying symptoms like difficulty swallowing, unexplained weight loss, or pain radiating to your arm or jaw, that's absolutely a sign to see your doctor immediately. Baking soda is a temporary fix for simple acid excess, not a treatment for serious underlying conditions, but for that occasional bout of post-dinner discomfort, it can be a real lifesaver. Following closely on the heels of general indigestion is the more specific issue of acid reflux. This is when stomach acid persistently flows back up into the esophagus, the tube that connects your mouth to your stomach. It's more than just occasional heartburn. It can be a chronic problem causing that burning sensation, a sore throat, a sour taste, or even a feeling of a lump in your throat. This can happen more frequently as we get older, sometimes due to changes in the valve between the esophagus and stomach, or certain medications we might be taking. Living with constant acid reflux is miserable. It can make sleeping difficult, affect your appetite, and just generally make you feel unwell. Again, baking soda can offer temporary relief here for those flare-ups. The principle is the same. It helps neutralize the acid that's causing the problem. Using half a teaspoon in a glass of water, sipped slowly, can help calm things down. Think of it as buffering the acid. However, just like with indigestion, this isn't a long-term solution for chronic acid reflux. Managing reflux often involves lifestyle changes like dietary adjustments, eating smaller meals, not lying down immediately after eating, and sometimes medication prescribed by a doctor. Using baking soda for reflux should be seen as an occasional tool in your kit for when symptoms are particularly bothersome, not as a replacement for medical advice or prescribed treatment. Always discuss chronic reflux symptoms with your healthcare provider. They can help you figure out the root cause and the best management plan for you. But knowing you have this simple option for quick relief during a bad episode can be very comforting. Moving on from the upper digestive tract, let's talk about discomfort further down, specifically bloating and gas, feeling like a balloon after eating, or experiencing uncomfortable pressure and gas pains is another common issue that can really impact your quality of life. It can make you feel self-conscious, uncomfortable in your clothes, and just plain miserable. Sometimes it's related to certain foods. Sometimes it's just part of the digestive process. And sometimes it can be linked to how well our digestion is working as we age. Baking soda might offer some help here too, primarily because it can help facilitate the release of trapped gas. As mentioned, when baking soda reacts with stomach acid, it creates carbon dioxide gas. That's the burp. While burping might seem like just a symptom, releasing that trapped air can sometimes alleviate the feeling of bloating and pressure for gas that's further down in the intestines. The effect is less direct, but by helping digestion start off with less acidic load, it might indirectly help some people. The method is the same: half a teaspoon in water, sipped slowly. The key here is that this is for occasional, mild bloating and gas, persistent or severe bloating, especially if it's accompanied by other symptoms like pain, changes in bowel habits, or weight loss. Absolutely needs to be checked out by a doctor. Bloating can sometimes be a symptom of underlying issues that require medical attention. So, while baking soda can be a simple trick for a quick bit of relief when you feel a bit puffy after a meal, it's not a cure for chronic digestive issues. It's about having simple, accessible options for minor discomforts that pop up in everyday life. Now, let's talk about something that affects so many of us as we get older: those creaky joints and general stiffness. Getting out of bed in the morning, walking up the stairs, or even just reaching for something on a high shelf can become a painful chore. Joint discomfort, whether it's mild aches or more pronounced stiffness, can really limit your mobility and independence. It can make simple activities feel like a huge effort and stop you from doing the things you love, like going for walks, gardening, or playing with your grandchildren. It's a reality many seniors face, and finding ways to ease that discomfort is often a top priority. While baking soda isn't a magic bullet for arthritis or other serious joint conditions, there's a theory that maintaining a more alkaline state in the body can help reduce inflammation, which is often a culprit in joint pain. This is where the idea of using baking soda for joint comfort comes in. Based on the concept of pH balance, the theory is that a slightly more alkaline body environment is less hospitable to inflammatory processes. Baking soda is, by its nature, alkaline. The suggested way to use it for this purpose is different from the immediate relief methods for digestion. It's usually recommended in much smaller doses taken regularly, not just when pain strikes. Some people suggest a quarter teaspoon, or even just an eighth of a teaspoon, dissolved in water once or twice a day. The idea is to gently influence the body's pH over time. However, The scientific evidence supporting this specific use for joint pain is limited and debated in the medical community. It's vital to understand that this approach is not a substitute for proven treatments for arthritis or other joint diseases, which might include medication, physical therapy, exercise, and weight management. If you have joint pain, the most important step is to see your doctor for a proper diagnosis and treatment plan. They can help you understand what's causing your pain and the most effective ways to manage it. Using baking soda for joint discomfort should be viewed as a complementary approach that some people feel helps them. Perhaps alongside doctor-recommended treatments, it's about exploring gentle, natural possibilities, but always with caution and awareness that it's not a medical cure. If you decide to try this for joint discomfort, start with a very small amount. Pay attention to how your body responds. And again, if you have any health conditions, especially kidney issues or high blood pressure, or if you're taking medications, you absolutely must consult your doctor first. They can advise you on whether this is safe for you to try, and if it might interact with anything else you're doing. So, we've touched on how baking soda might offer some temporary help for common digestive discomforts like indigestion, heartburn, and bloating, and explored the idea of using it to potentially support joint comfort based on the alkalinity theory, always stressing the importance of medical advice. Now, let's continue our exploration of the potential uses of this versatile item and look at a few other health issues that can become more prevalent as we age. One condition that many people, particularly men, but also women, become concerned about is gout. Gout is a form of arthritis caused by a buildup of uric acid crystals in the joints, often causing sudden, severe attacks of pain, swelling, redness, and tenderness. Most commonly in the big toe, it's incredibly painful and debilitating when it flares up. Managing gout typically involves dietary changes, lifestyle adjustments, and often medication prescribed by a doctor to lower uric acid levels. Now, there's a traditional idea that baking soda can help with gout because it might help the body excrete uric acid. The theory is that by making the urine more alkaline, baking soda can help the kidneys eliminate more uric acid, thus potentially lowering levels in the blood and reducing the risk of crystal formation or helping during a flare-up. Some people recommend taking a small amount, perhaps half a teaspoon dissolved in water, a couple of times a day during a gout attack, or even regularly as a preventive measure. However, just like with the general joint pain idea, using baking soda for gout is a traditional remedy and not a medically proven treatment. While it might have a minor effect on urine pH, its ability to significantly lower blood uric acid levels or treat an acute gout attack is not supported by robust scientific evidence. Furthermore, taking baking soda internally, especially regularly, can have side effects due to its sodium content, which can be problematic for people with high blood pressure, heart conditions, or kidney problems, conditions that can sometimes coexist with gout. If you have gout, it is absolutely essential to work with your doctor. They can prescribe medications that are proven to effectively lower uric acid levels and manage acute attacks. Dietary changes, like limiting purine-rich foods, red meat, seafood, alcohol, especially beer, are also crucial and recommended by medical professionals. Using baking soda should only be considered as a minor, potentially complementary approach after discussing it with your doctor, and never as a replacement for your prescribed gout treatment. They can help you weigh the potential risks and benefits based on your overall health picture. It's wonderful to explore natural aids, but always prioritize evidence-based medical care for conditions like gout. Next, let's gently touch on urinary tract health. Urinary tract infections, or UTIs, can become more frequent in older adults. They can cause burning during urination, frequent urges to go, and discomfort. While UTIs require medical treatment, usually antibiotics prescribed by a doctor, some people explore ways to help manage symptoms or potentially support recovery alongside medical care. The theory behind using baking soda for UTIs is similar to the gout idea. It's thought that making the urine more alkaline might create a less favorable environment for bacterial growth and could potentially help reduce the burning sensation. Again, this is a traditional or anecdotal use, and its effectiveness as a treatment for UTIs is not proven by medical science. UTIs are bacterial infections that need to be treated with antibiotics to clear the bacteria completely and prevent the infection from spreading, potentially to the kidneys. Delaying proper medical treatment by relying solely on home remedies like baking soda can be dangerous. However, some people report that drinking a small amount of baking soda in water, say half a teaspoon in a glass, can temporarily help reduce the acidity of the urine and thus lessen the burning sensation while they are waiting to see a doctor or are already on antibiotics. If you suspect you have a UTI, the most important thing is to contact your doctor right away to get a proper diagnosis and prescription. Do not use baking soda as a substitute for visiting your doctor or taking prescribed medication. It is not an antibacterial agent and will not cure the infection. If you do decide to try it for temporary symptom relief while awaiting medical care, remember the cautions about sodium intake, especially if you have related health conditions, and always inform your doctor about anything you are taking or trying. This leads us naturally to talk a little about kidney health in general. Our kidneys are vital organs that filter waste and excess fluid from our blood to make urine. As we age, kidney function can sometimes decline, and certain conditions like diabetes and high blood pressure, which are common in seniors, can also affect kidney health. Some research has looked at using sodium bicarbonate, the main component of baking soda, under medical supervision to help people with chronic kidney disease manage acid levels in their blood, as the kidney's ability to do this can be impaired. However, this is a complex medical treatment given in specific doses and under strict monitoring by kidney specialists. Using over-the-counter baking soda on your own to try and improve kidney function or cleanse your kidneys is not recommended and can actually be harmful. The high sodium content can be particularly problematic for people with impaired kidney function, potentially leading to fluid retention and increased blood pressure. Furthermore, disrupting your body's natural acid-base balance without medical guidance can be dangerous. If you have concerns about your kidney health, the absolute best thing you can do is talk to your doctor. Simple blood and urine tests can assess kidney function, and your doctor can provide evidence-based advice on how to protect your kidneys through diet, lifestyle, and managing any underlying conditions. Do not self-treat kidney issues with baking soda. While sodium bicarbonate is used in a medical context for some kidney conditions, it is not the same as self-administering baking soda for general kidney health. This distinction is crucial for your safety. Shifting gears to a different kind of discomfort, let's talk about sore throats and coughs. These are common ailments that can make swallowing painful and disrupt your sleep. As we get older, our immune systems might not be quite as quick to bounce back, and lingering coughs can be particularly bothersome. While most sore throats and coughs are caused by viruses and just need time, and perhaps some gentle care to resolve, finding ways to soothe the symptoms can make a big difference in your comfort level. This is another area where baking soda has been a traditional go-to remedy. One of the simplest and often most effective uses is as a gargle. A warm salt water gargle is a well-known remedy for sore throats, and adding baking soda can potentially enhance its effects. Baking soda is alkaline, and the theory is that it can help neutralize acids in the throat, perhaps from postnasal drip or bacteria, which can cause irritation. It might also help break up mucus and reduce inflammation. To make a baking soda gargle, dissolve about half a teaspoon of baking soda and, optionally, half a teaspoon of salt in a glass of warm water. Gargle with this mixture for 30 to 60 seconds, tilting your head back to let it reach the back of your throat, and then spit it out. Do not swallow the gargle. You can repeat this several times a day as needed. While a baking soda and salt gargle won't cure the underlying infection, it can provide soothing relief for a scratchy, painful throat and help clear some of that annoying mucus. It's a gentle, natural way to ease discomfort while your body fights off the cold or virus. If your sore throat is severe, doesn't improve after a few days, is accompanied by a fever, difficulty swallowing, or swollen glands, it's important to see a doctor to rule out a more serious infection like strep throat. But for that common, scratchy, irritating sore throat, a baking soda gargle can be a comforting ally. We've covered quite a bit already, from digestion to joints and even sore throats. exploring how simple baking soda might play a role in addressing these common issues, always emphasizing caution and the importance of medical advice. Now, let's continue our journey through the 13 uses and look at some everyday ways. Baking soda can enhance your comfort and well-being. How about your mouth? Maintaining good oral hygiene is incredibly important as we age, not just for keeping your teeth and gums healthy, but because oral health is linked to overall health. Gum disease, dry mouth, often a side effect of medications, and changes in taste can all become more common. Finding simple, effective ways to keep your mouth clean and fresh can make a big difference in how you feel and how confident you are interacting with others. Baking soda can be a wonderful, natural addition to your oral hygiene routine. For centuries, people have used it as a toothpaste or mouthwash. It's a mild abrasive, which can help gently polish away surface stains on teeth, and its alkaline nature can help neutralize acids in the mouth produced by bacteria. Which are the main culprits behind tooth decay and gum disease? Using it as a mouthwash is simple. Dissolve about a teaspoon of baking soda in half a glass of water. Swish this solution around your mouth for about 30 seconds to a minute, making sure it reaches all areas, and then spit it out completely. You can use this after brushing or at other times during the day for a quick refresh, especially if you suffer from dry mouth. It can help wash away food particles and neutralize odors, leaving your mouth feeling cleaner and fresher. You can also use baking soda as a paste for brushing, either on its own or mixed with your regular toothpaste. To make a paste, just add a little water to a small amount of baking soda until it forms a thick paste. Dip your toothbrush in it and brush gently. While it can help with surface stains and neutralizing acid, remember it doesn't contain fluoride, which is crucial for strengthening tooth enamel and preventing cavities. So, if you use baking soda as your primary cleaning agent, you might miss out on the protective benefits of fluoride found in most commercial toothpastes. Many people find a good balance by using a fluoride toothpaste for their main brushing and incorporating a baking soda mouthwash or occasional baking soda paste for added freshness and acid neutralization. As always, maintaining regular checkups with your dentist is key to good oral health. They can provide personalized advice and care. Moving down the body, let's consider your feet. Our feet do so much for us, carrying us through life, but they can often get neglected. Tired, achy feet, foot odor, and even some minor skin irritations on the feet can become more common concerns. After a long day, wouldn't it be lovely to give them a little TLC? A baking soda foot soak is a simple, soothing, and effective way to refresh tired feet and tackle odor. Baking soda's alkaline properties can help neutralize the acids that contribute to foot odor, which is often caused by bacteria thriving in sweaty environments. It can also have a gentle, softening effect on the skin, making it easier to deal with rough patches or calluses. To prepare a foot soak, fill a basin or tub with warm water, comfortably warm, not too hot. Add about 3 tablespoons of baking soda to the water and swish it around to dissolve. Sink your feet into the soothing water and relax for 15 to 20 minutes. You can gently rub your feet while they're in the soak to help exfoliate. Afterwards, dry your feet thoroughly, especially between the toes. This simple ritual can leave your feet feeling refreshed, cleaner, and less smelly. It's a small act of self-care that can make a noticeable difference in your comfort at the end of the day. For persistent foot issues, like fungal infections or severe odor, it's best to consult a podiatrist or doctor. But for everyday tiredness and odor, a baking soda soak is a fantastic, inexpensive remedy. Speaking of skin, let's look at how baking soda can help with minor skin irritations or itching. Sometimes, you get a little rash from something you touched in the garden, or maybe an annoying insect bite, or even just dry, itchy skin that flares up. These minor irritations can be incredibly uncomfortable and distracting. Baking soda can provide soothing relief for many types of minor skin itching and irritation due to its anti-inflammatory and alkaline properties. It can help calm the skin and reduce redness. For widespread itching, you can add baking soda to your bathwater. Dissolve about half a cup of baking soda in a lukewarm bath and soak for 15-20 minutes. The water should be lukewarm, not hot, as hot water can dry out and further irritate the skin. For localized itching, like an insect bite or a small patch of irritation, you can make a paste. Mix a small amount of baking soda with just enough water to create a thick paste. Apply this paste directly to the affected area and leave it on for 10 to 15 minutes before gently rinsing it off. This can provide temporary relief from the itch and sting. Remember, this is for minor irritations. If you have a severe rash, allergic reaction, broken skin, or if the irritation persists or worsens, you should see a doctor. Baking soda is a natural soother for common, mild skin discomforts, not a treatment for serious dermatological conditions. Moving on, let's talk about something that can affect confidence and social comfort: body odor. Changes in metabolism, sweating patterns, and even medications can sometimes contribute to changes in body odor as we age. While regular washing is key, sometimes you might want a little extra help to feel fresh throughout the day. Baking soda can act as a natural deodorant because of its ability to absorb odors and neutralize acids that contribute to odor-causing bacteria. Instead of just masking smells, it helps tackle them at the source. Many natural deodorants on the market actually use baking soda as a primary ingredient. You can use plain baking soda as a simple underarm deodorant. After washing and drying your underarms thoroughly, you can simply dust a small amount of dry baking soda onto the area. Some people find this effective on its own. Alternatively, you can mix baking soda with a small amount of cornstarch, which helps absorb moisture, and perhaps a carrier oil like coconut oil to make a simple homemade deodorant paste. Be aware that, for some people, baking soda can be irritating to sensitive underarm skin, especially if used immediately after shaving. If you experience redness or itching, discontinue use. But for many, it's a gentle, effective, and inexpensive way to stay fresh, naturally. Finally, let's touch on the idea of using baking soda for a little bit of a gentle energy boost. This isn't about a sudden jolt of energy like caffeine, but rather a more subtle effect based on the body's pH balance, sometimes referred to as buffering. In the context of strenuous exercise, athletes sometimes use sodium bicarbonate to buffer lactic acid buildup, which can delay fatigue. For people over 60, intense exercise might not be the focus, but the idea of supporting the body's natural balance is still relevant. Some proponents of alkaline diets suggest that maintaining a slightly more alkaline state in the body can help support overall vitality and energy levels. While the body has its own complex systems for regulating pH, and dietary changes have a limited impact on blood pH, the idea is that reducing the acidic load on the system might free up energy for other functions. Taking a very small amount of baking soda, like an 1/8 or 1/4 teaspoon in water once a day, is sometimes suggested as a way to gently support this alkaline balance. However, it's crucial to reiterate that the scientific evidence for baking soda significantly impacting energy levels through this mechanism in everyday life for seniors is not strong. Any perceived energy boost might be subtle or related to other factors. The real key to energy for seniors lies in a balanced diet, regular gentle exercise, adequate sleep, stress management, and addressing any underlying health conditions with a doctor. Using baking soda for a gentle energy lift should be approached with caution. As with any internal use, due to the sodium content, it is not a substitute for healthy lifestyle habits or medical treatment for fatigue. If you consistently feel low on energy, it's important to talk to your doctor to identify any potential causes, such as nutritional deficiencies, thyroid issues, or other medical conditions. While the idea of baking soda as an energy booster is out there, it's perhaps the least proven of the uses we've discussed and should be considered only as a very minor, cautious experiment after consulting your doctor. So, we've journeyed through 13 different ways. This simple box of baking soda might offer some help and relief for common issues faced by seniors. From soothing your stomach and supporting joint comfort to freshening your mouth and feet, calming irritated skin, dealing with odor, and exploring the concept of a gentle energy lift. It's truly surprising how many potential applications this one humble ingredient has. Remember, the key takeaway throughout all of these uses is that baking soda is a simple, inexpensive tool for temporary relief or complementary support for minor issues. It is not a magic cure, and it is absolutely not a substitute for professional medical advice, diagnosis, or treatment. If you have any health concerns, symptoms that are severe or persistent, or if you have underlying health conditions like high blood pressure, heart disease, or kidney problems, or if you are taking any medications, you must talk to your doctor before using baking soda internally or regularly. They can help you understand what's causing your issues and recommend the safest and most effective treatment plan for you. Think of baking soda as an extra tool in your self-care kit, something you can reach for that occasional bout of indigestion, that annoying insect bite, or that tired feeling in your feet after a long day. It's about exploring natural, accessible options to enhance your comfort and well-being in simple ways. Small changes and simple remedies can truly make a difference in how you feel day to day. It's about feeling empowered to address those little things that can niggle at you, using resources you might already have at home. I hope you found this exploration interesting and perhaps even helpful. Have you ever used baking soda for any of these purposes? Or perhaps for something else entirely? I would love to hear your experiences and thoughts in the comments below. Sharing our knowledge and experiences can benefit everyone in this wonderful community. If you found this video valuable, please give it a thumbs up. That helps more people discover this information. And if you haven't already, consider subscribing to the channel. We share tips and information focused on helping you live your healthiest, happiest life at every age. Don't miss out on future videos that can provide simple, practical advice for navigating senior health and well-being. Thank you so much for watching and spending this time with me. Remember, you have the power to make choices that support your comfort and vitality. Keep exploring, keep learning, and keep taking wonderful care of yourself. Live your best life at every age.